everyone. Today's TMA's expert is an immunology edition. We are so happy to have you with us today. I'm Rachel Brown, TMA Senior Manager of Patient Education and Advocacy. For those of you joining us for the first time, we're broadcasting from Maryland. Well, at least I am. Our doctor is broadcasting from Paris, France, I believe. And we'd love to know where you are tuning in from. Everyone, please feel free to share your and make sure that your message is going to everyone and not just the hosts and panelists. You can change who the message is going to by hitting the down arrow in the blue button at the bottom of your chat box. It is so wonderful to see how far this community is. My association has been dedicated to improving the lives of those with myositis, fund innovative research, and increase myositis awareness and advocacy. We envision a world without myositis, and we work tirelessly to get closer to that goal every day by providing education, support, and resources to the myositis community. You let us know that our webinar series is one of the most valuable ways we engage with you. From TI's Medical Advisory Board or other distinguished members of the myositis medical community, and today is no exception. We encourage you to take full advantage of the opportunity, ask your questions in the Q&A box, engage in the chat, and share your team, family, and friends to help educate others about myositis. Before we get started, I want to let you know that this webinar is being recorded, and it will be on our YouTube first of next month. We also have a disclaimer. TMA does not give medical advice. Our educational webinars are informational, and we encourage you to make all decisions about your care in partnership with your healthcare team. TMA is very grateful for our expert speakers from all over the world, and we ask each speaker to disclose any potential conflicts at the start of their presentation. Please put your questions in the Q&A box. Pre-submitted questions are being loaded into Q&A by TMA, and questions put in the chat box may be missed, especially today when I'm working with only one screen. TMA evaluates its programming to ensure we are meeting the needs of the myositis community. A survey will pop up at the end of the webinar, and we ask that you please take a few minutes to provide input to inform future programming. Now, with all that said, I am so excited to introduce our expert speaker today, Dr. Yves Allenbach. He is an immunologist working at Sorbonne University in Paris, France, and also currently a member of our medical advisory board. Welcome.
Thank you. Thank you.
All right, well, let's get started. I'm going to share the slides.
Yes, I prepared some slides to try to answer the question you ask us. It will be more easy for me if you agree.
Yes. Okay, let me put it in present mode. Dr. Allenbach, see it?
Thank you. Yes, we can move to the next slides. And so we received several questions concerning the way to improve the immune system, and especially concerning the diets. You ask what could be the best foods to strengthen one's of the immune system. Over ask, are there good over the counter supplements to help boost immunity? How much of difference does a great diet make? And so there is several questions concerning the diet and the immune system. So we can move to the next question. Slide, please.
Yes.
Okay, so in few words, as you can see, there is no specific diet to improve the immune system. To make it short in few words, we can move to the next slide to explain why I say that. In fact, there is no clear evidence linking immune system and the nutrition and diets. There is several research on that. For as far as we know, in very specific condition as very severe malnutrition, there we can sometimes observe immune deficiencies, but in most of cases, there is no link between diet and weight with the immune system. You know that overweight may be associated with some complication as metabolic complication, to give you an example, the diabetes, or mechanical complication like osteoarthritis, but there is no.
I'm sorry, I'm messing up your presentation. I've got to go backwards.
Yeah, but there is no clear evidence between intake and the strength of the immune system. So we can, you can do nothing concerning the diet to improve your immune system. You must be aware about that frequently patients with myositis are exposed to glucocorticoids, and in that time you may you have to limit the sweet, the carbohydrates intake to avoid overweight while you are exposed to high dose of glucocorticosteroids. But except for this very specific condition concerning situation concerning the myositis, you again, there is no specific things to do concerning the diet to improve the immune system. The point is that, in fact, you have to be aware that autoimmune disease results from a kind of mistake, a mistake of the immune system to make the difference between what is yourself and what is not yourself. I mean, pathogens, microorganisms, viral infections. And this is the confusion that the human system make that leads to the disease and to the muscle disease. But this is not because your immune system is too weak. So in patients with myositis, there is no kind of weakness of the immune system, but there is a kind of error of the immune system, which is not able anymore to make the good difference between what he have to protect, the body, the muscles, and what he have to fight against the infection. So in few words, there is no immune deficiency, no weakness of immune system concerning patient with myositis. And anyway, there is no way in the diet to improve the immune system strength. We can maybe move to the next slide. And usually people ask us the same type of question, and usually I I hear that patient asks me, what can I do to fight against my illness? Because usually I think that when I was asking for what which type of diet, which type of diet I have to make, I understand that this is the only way I have in my hands to control my health. And so I would suggest to the patient, rather than to focus on the diet, to focus on something else, to focus on the physical exercise. Maybe we can move to the next slide, please, Rachel. Thanks. And so the action we can have against the illness is probably to move, to have exercise. And the rationale for that is that we can move to the next slide, is that in patients with a myositis, I usually compare the myositis and the condition to a forest fire, where the trees are the muscles and the fire are the autoimmune attacks, the error of the immune systems that attack your muscles. And usually I compare the treatment to the fireman's to the fireman's. And so in fact, when you take the pills, the treatment, the drug, you uh, you in fact use the fireman to try to stop the fire. The point is that if we move to the next slides, if we move to the next slide, please. Thank you. In fact, the treatment or the drug make not nothing, but quite nothing concerning the muscle. The treatment, the drugs block, like fireman, the fire. But once the treatments reach to block the fire, in fact, there is nothing. The trees needs, the muscle needs to regenerate, and so this is not the treatment which helps you to rebuild your muscle mass. This is the exercise. The exercise help to regenerate to regenerate the muscle mass, like the nature help to regenerate the trees. But again, the treatments are not helpful by their own for the muscle mass. The treatment block the fire, block the disease activity, and the only things you can do in your way of life to improve your condition is to make exercise to help muscle regeneration. Maybe we can move to the next slides. We also receive questions concerning the vaccines and vaccines against hepatitis and against COVID. And one question that we also have regularly with patients is, what could be the side effect of the vaccine concerning the disease and especially the inclusion body myositis? We can move to the next slides, please. The answer is that probably no. Probably the vaccine and COVID vaccine will not exacerbate symptoms of myositis and especially symptoms of and symptoms of IBM. There is not so many evidence to claim that, but there is no clear rationale to think that the vaccine could exacerbate or induce a flare of myositis or exacerbate symptoms of IBM. We can move maybe next to the next slides. Still, there is some evidence in research on in patients with myositis focusing on adverse events related to vaccine and especially COVID-19 vaccine. And there is a recent publication made by a US group, Reut Agarwal's, who focus on the adverse event of vaccine in patients with myositis. The answer is that, if we can, maybe it's written on the next slide, the answer is that there is a slight increase. Sorry, yes, that's good. That's okay. The answer is that in the previous study, it's that patients with myositis and vaccine against COVID may have an increase short-term adverse events. I mean, pain in the shoulder, headache, very few symptoms like that, but no flare of the disease, and there is no evidence showing that the vaccine worsen the condition and the myositis. In the other hand, there is some observation linking viral infection and myositis. That time is not anymore the vaccine, but the virus infections itself. We know that there is some seasonality of diagnosis of myositis, especially after outbreaks, and more precisely, probably in a subgroup of patients with dermatomyositis. This is not clearly the case for IBM patients, but still, at least for dermatomyositis patients, it looks like there is a correlation between outbreaks and new cases of myositis, especially dermatomyositis, and especially in a subgroup of dermatomyositis, dermatomyositis associated with the antibody anti-MDI5. This is a subgroup of patients, and clearly it was reported that there is an increased rate of new cases of dermatomyositis with MDR5 antibodies after COVID outbreaks. It was reported recently. We have also data on that. And this data suggests that for some patients, viral infection could trigger the disease. There is also observation along that line. If you measure in the blood of patients with myositis the level of interferon, interferon is a kind of weapon that the immune system uses to fight against viral infections. And what is striking to see is that in the subgroup of patients with dermatomyositis, there is a clear increased level of interferon in patients with dermatomyositis, especially those with MDR5 antibodies. And so there is other additional evidence, but together, this kind of evidence suggests that in some cases and in some subgroup of patients, dermatomyositis patients, it looks like viral infections could trigger the development of dermatomyositis, but there is no evidence that the vaccine could induce the disease or a flare of a disease. Maybe we can move to the next slides. We were also asked if IBM affect the skin or could be linked with itchy manifestation, especially on the legs. The answer is no. We can move to the next slide for having more detail on that. You know that myositis is in fact an heterogeneous group of diseases. The bottom line is skeletal muscle attacks by the immune system. This is an autoimmune conditions, but still this is a very heterogeneous group of muscle disease. And in fact, we are able to split myositis in four main categories: IBM, IMNM, dermatomyositis, and antisynthetase syndromes. Doctors are able to make difference between patient based on the onset of the disease, based on the topography of the weakness of the patient, and based on the type of muscle damages that we can observe on skeletal muscle biopsy of the patients. We can move to the next slides. We can also make distinction between the four main subgroup of patients based on the presence of extramuscular manifestations. And in fact, patients with IBM do not display any extramuscular manifestation. This holds true for patients with immune-mediated necrotizing myopathies, but this is not true for other group of myositis. Dermatomyositis have always skin rash, and antisynthetase syndrome have highly frequently skin manifestation or lung manifestation. But again, IBM patients do not have any extramuscular manifestation. This is a very specific condition to the muscle tissue. We can move to the next slides. And this is just a few examples of what is the type of skin rash that some myositis patient may have. This is example of patients having dermatomyositis with skin rash on the hands, and this type of skin rash are very specific for dermatomyositis. We can move to the next slides. It's just to give you just an example. And this is another skin rash on the eyelids of a patient with, again, a dermatomyositis. We can move to the next slides. This is skin manifestation that some dermatomyositis patient may have in the neck, on the legs. But again, in IBM patient, there is no skin manifestation. Maybe we can move to the next slide. I'm sorry for the slide. There is some, it's like that. I'm sorry. So we also received several questions concerning the association between different conditions in individual patient with myositis. In that case, we received a question concerning the association between myositis, inclusion body myositis, with FSHD. FSHD is a very rare genetic muscle disease, in addition with celiac and spondylitis. And this kind of manifestation is quite unusual for patient, but still, we can say that in one individual with one myositis, with one autoimmune muscle disease, it's not rare to combine several autoimmune disease. It's frequent to have several autoimmune disease. It's totally infrequent to combine autoimmune muscle disease with genetic disease like FSHD. But combining celiac disease, which is an autoimmune condition, with another autoimmune condition like myositis, is not so rare. So yes, patient may have several different autoimmune disease and conditions. We can move to the next slide. So to explain that point, here this is a list of different autoimmune conditions. There is in that list no muscle condition, but you have, sorry, you have, maybe we can go back to the previous slides. Yeah, thank you. You have autoimmune condition associated with type 1 diabetes. You have multiple sclerosis. And on the left part, you see that there is some specific genetic background associated with these conditions. And you see that in one genes, but we will see afterwards what is a genes. But some variant genes, the same variants, may be associated with different autoimmune condition. But maybe we can move to the next slide to be more clear. In fact, we can see the genetic background like plants to build the body. Maybe we can move to the next slides. And with these plants, the cells in the human build the body. We can move to the next slides. Yes, thank you. We can move to the next slides. And again, if there is, and we have different color of skins, we have different color for the eyes, different color for the hairs, and this holds true for our immune system. My immune system is slightly different from somebody else, and each one have very slight variation in the genetic backgrounds leading to the constriction of the immune system. So we do not all have exactly the same immune system, as we do not have exactly the same color of eyes or the skins. And so the doctor were able to demonstrate that there is some genetic variation, genetic background more frequently associated with an autoimmune condition. Maybe we can move to the next slides. And still, once we have this slightly genetic background more frequently associated with the occurrence of um, an autoimmune disease. This not means that you will necessarily have the autoimmune disease. To give you an example, if you take a multiple sclerosis and the genetic background associated to the multiple sclerosis, and if you take a very rare situation with twins who have exactly the same genetic backgrounds, it's very exactly the same things, you would say that if the twins have the same genetic backgrounds associated with the development of multiple sclerosis, only you will see a concordance between the multiple sclerosis in only 20% of the twins. So it means that the genetic may be important for the occurrence of developing of a genetic disease, and especially myositis. But this is not a genetic disease, but because you need something else. Because most of the time you have this genetic background, but you will never develop myositis, you will never develop a genetic an autoimmune disease. We can move to the next slides. So one key question that usually patients ask us, why? Why I have this myositis? So we answer that you need first a specific genetic background, but is not sufficient to develop the disease. And afterwards, we know that it could be possible that something in the environment could trigger the occurrence of the disease. So we see together previously that probably a viral infection could trigger in a specific genetic background the occurrence of a myositis. And we know that there is probably environment factors like dust, and we know that after the 9/11 that firemen develop more frequently autoimmune condition. We can move to the next slides. So dust pollutants may be involved in as trigger genetic disease, autoimmune disease as myositis in patient with a specific genetic background. We can move to another slides. We also know that there is also triggers. Patient reports or ask us very frequently if the stress could be associated with the development of the myositis, and there is no specific study on that topic for myositis, but there is a very large study on stress and stress-related disorders and the occurrence of autoimmune disease condition in general. And this paper very nicely show that it is possible that stress-related disorder could be involved in the development of autoimmune disease and condition, and why not in myositis. And this was suggested again in a subgroup of homogeneous twin in this study. Maybe we can move to the next slides. So this is a busy slides to show you that there is some autoimmune disease associated with stress. So I won't not go in detail for this study. So to try to answer your points, finally, there is some specific genetic background associated with autoimmune condition in general. And you need to be exposed probably to some environmental factors to develop the autoimmune disease. And since the background is frequently the same for different autoimmune conditions, it is frequent to have different autoimmune condition in individuals, especially in myositis patients. So we move to another question. You ask us if there is any updates concerning inverse vaccine treatments. So to make it clear, inverse vaccine is a way to tolerate something. And in autoimmune condition, the definition is that you do not tolerate anymore yourself, your skeletal muscle. And this leads to an autoimmune attack of your skeletal muscle tissue. So inverse vaccine is an approach, a way to try to restore tolerance in patients with autoimmune condition, and especially in patients with myositis. So, to my knowledge, there is no type of update or progress in this situation to restore skeletal muscle tolerance in patients with myositis. But still, we can move to the next slide. So it's a small cartoon I made. So what happens in our body when there is a myositis? So I compare the immune cells to soldiers, and this army is supposed to protect ourselves against um, foreign um, foreign aggressions. And what happened in patient with myositis, there is a mistake, and again the immune cells fights against the muscle cells. We can move to the next slides. And still, the immune cells are able to do the job. I mean, killing infections or pathogens. So we can move to the next slides. So again, what is wrong in patients with myositis? The immune cells try to fight against muscle cells as they fight against infections. What we do when we propose treatment to patients, we develop or we use conventional treatments, immunosuppressive drug. All of these drugs aims to limit, to block the immune cells activity. So when we use conventional treatment, we block the immune cells involved in muscle damages. But in the same time, because this is not targeted treatments, in the same time, we decrease also the efficacy of the good soldiers uh, who try to protect ourselves against infections. So most of the treatment we use are efficacious to decrease the efficacy of the immune system against muscle attack, but in the same line, you also decrease the efficacy of the immune system to fight against infections. And this is the reason why quite all treatments we use currently to fight against autoimmune disease and myositis are also associated with an increased risk of infections. We can move to the next slide. But now there is more and more targeted treatments, and we will probably soon be able to try to just target only the few immune cells involved in the muscle attack. and to preserve the other immune cells, to preserve the ability of the immune system to fight against infections. So now there is more and more targeted treatments in development that will lead to things that we will be able to not to make a kind of inverse vaccine, but finally to restore the tolerance of muscle cells while not decreasing the efficacy of the immune systems against viral infections. We can move to the next slides. So you also ask us if there is a way or it's possible to have a complete disease remission without any drugs. In fact, I would say yes. We can move to the next slide. In fact, again, as we said, conventional treatment like fireman do not cure, do not induce complete remission. I mean, if you stop the treatments. It's like firemen, you know, you use drugs, you use firemen that stop, that put out the fire. But if you stop the fireman, the fire restarts. So this is why patients need to maintain the treatments, to take every day or prolonged treatments to maintain the fireman to avoid any restart of the fire. And in fact, probably the treatment do not have any effects about concerning the possibility of the fire to be restarted. The point is that usually after 2 or 3 years, in some condition we say, okay, so maybe there is no reason for a new fire. Maybe you do not need anymore to have firemen in the forest to stop any fire, because maybe there is no reason that the fire will come back. And so usually after 2 or 3 years, we say the only way to know if the disease is gone is to stop the treatment and to see what happens. And if the patient is cured without any treatments, the patient will be still in remission without any restart flare of the disease, without any fire anymore. But so there is frequently there is moments where the breakdown of tolerance, the fire, the cause of fire is not there anymore. But the treatments, the firemen do not nothing on that today until yet. So the immunosuppressing drug we use do not induce complete remission, meaning that you need to keep your treatment for years to avoid relapse. But still, after years, sometimes it's not necessary anymore, and you can stop the treatments. But there is again new treatment. There is new breakthrough in the field of autoimmunity, and for the first time, we think that maybe we will be able to cure the patient. And there is a very preliminary data suggesting that very targeted treatments in developments may totally destroy the few human cells which are wrong, which are the source of the muscle disease. And if we are able to specifically destroy these cells, for a definite time, that time we think that we will be able to cure the patient. And now it's possible to think that it will be possible, and there is some experiments with a CAR T cell. This is a very new type of drug used to treat patients with lymphoma that were used to treat some patients with very severe myositis, not IBM, but enthesitis patients, suggesting that this type of treatment may be able to delete the immune cells involved in the condition. And after these treatments, it could be possible, we don't know, that patient will be cured without adding or taking any more immunosuppressive drug. But still, these reports were done 2 years ago for the oldest one, so we don't know yet if it's true or not. But we are now thinking that it could be possible in the future to use drug to say, okay, maybe you are cured for a long time without needing to take for a long time immunosuppressive drug. Maybe we can move to the next slide. So we were also asked if muscle MRI is able to detect any flare of the myositis. And in few words, we will say that yes, it is possible. We can move to the next slides. So in few words, when you perform a muscle MRI, you have two basic answers. You may see here, also here it's the slides of tides on MRI. So the gray area is the muscle, the white area is the subcutaneous tissue with fat, in fact. And in this patient, you see that there is no anymore, there is no anymore gray zone. It's like fat because the muscle was totally destroyed by a genetic disease. It is a genetic condition there. So the genetic condition destroy the muscle, and so the muscle is replaced by fat tissue. And so when you perform a muscle MRI, you may see muscle damages, and this holds true for patients with myositis. Is again, this picture is from a patient with a genetic muscle disease, not a myositis. The other answer you have when you perform a muscle MRI is you can see here, this is a different type of pictures, but the white picture, the white dot, that time show not anymore the fat here, but show the fire, the edema, the damage, yes, the fire, in fact, like a redness on your skin. And so when there is white signal there, it suggests that there is inflammation within the muscle tissue, like muscle attack, like fire in the tree, in the forests. So it's possible to detect the fire, the muscle edema in muscle tissue of patient with autoimmune disease. And we can move to the next slides. So the gold standard, the best way to know if there is fire, if there is inflammatory immune cells within the skeletal muscle tissue, the best way to know that is to perform a muscle biopsies. And this is the way usually we do for the diagnosis of patient. And afterwards, you can see with a microscope the muscle tissue. So the pink area correspond to muscle, to the skeletal muscle tissue, and the small purple dots represent, in fact, immune cells attacking the muscle fibers. So this is the best way to see that there is a flare of the disease, that there are, in fact, immune cells within the skeletal muscle tissue. The best way to see that is to perform myopathological analysis with a skeletal muscle biopsy. So, in fact, there is a very good correlation between these features with the muscle MRI I show you. Still, the myopathological analysis are the most sensitive way to detect flares, to detect inflammatory infiltration within the skeletal muscle tissue, but still there is a very good correlation between muscle edema on MRI, the white hypersignal, and this type of pathological exam. And the predictive value of muscle MRI for the presence of myositis flare is around 80%. So the answer is you are able to detect a flare with a sensitivity above 80% using a muscle MRI in a patient. So it means that you cannot formally rule out the possibility of a flare in a patient with a normal MRI, but still the predictive value of this abnormal high hypersignal is a very good way to say that the patient probably have a flare of the disease. Maybe we can move to the next slides. So I think this is the last question you asked us is how Apcuro is working. So Apcuro is a drug developed initially by Steve Greenberg, and the story is like that. In fact, when you perform a muscle biopsy in patient with an IBM, so what I will show you here is specific to IBM. One of the key feature of patient with IBM is that. So here you can see a muscle fiber there. It is a muscle fiber. And here again, you see the purple dots. The purple dot are, we can move to the next slide, are like immune cells, like soldiers. In fact, as we say previously, in fact, there is an error of the immune system. It's a mistake. The immune cells attacked here the muscle fibers. What we know is like in the army, in fact, the uniform is not the same in all the army, and it is possible to recognize sometimes soldiers based on the color of the uniform, based on the form of the helmets, and so there is like surface markers on the surface of the cells, like some foam on the surface of the helmet of soldiers. And what Steve Greenberg was able to demonstrate, it was able to demonstrate that what is very surprising is that soldiers attacking the skeletal muscle fibers of IBM patient display something known as KLG1, like a small, let's say a small ball on the surface of the helmet of the immune cells within the skeletal muscle tissue of IBM. So think about a way to design a drug like a weapon, which will be specific for these soldiers, and design a drug able to specifically recognize only soldiers harboring KLRG1 proteins, the small balls. And so people with IBM are infused with these drugs, and the drugs come in the bloodstream of the patient and will do nothing except if the drugs recognize specifically the soldiers harboring KLRG1, the balls, and that time the drug will be activated and kills and destroy this type of soldiers. And since most of our soldiers in the immune system do not have core LRG1 expression, the drugs will not kill our immune system, but just kills the group of soldiers within the muscle tissues which are positive for KLRG1. And so this is how APCURO is working. Maybe we can move to the next slide, but I think we are done with the question you ask.
All right. Well, we have a little more on the Q&A. I am not sure if my audio is okay. I can't do anything to my audio, but the doctor.
I cannot hear you well. Maybe I will check the Q&A. So, have you seen somebody have increased immune response after starting immunosuppressants? For example, new developments of food and of an allergy. Okay, if okay. So no, I never met patient with immunosuppressants who develop kind of allergy or this type of adverse event. So basically, as we said, usually immunosuppressive drug decrease the efficacy of the immune system to limit the attack of the immune system against the muscle tissue. And so the bottom line is that this type of treatment increases the frequency of infection, but not induce or improve the strength of the immune system. The patient do not develop allergy with methotrexate to respond to answer precisely. So there is another point. IBM is notoriously resistant to immunosuppressive therapy. Any idea? That's a very critical question. So, and I do not have a clear answer to you now. In fact, there is two views of the disease. One view is to see the disease as a degenerative disease, like the muscle tissue is not dying too fast, but it's a kind of degenerative disease. And the view of that, the people who think that this is a degenerative disease, thinks that that the inflammatory cells that we see in addition within the skeletal muscle tissue is a secondary mechanisms. And so people say that it is not maybe useful to try to control the immune system, because the immune system invasion is just a consequence of the degenerative muscle disease. The point is that probably if you treat very efficaciously, you try to block very efficaciously the immune system, there is data showing that patients do not decrease, or the treatment suggests that patient remains stable. So in fact, there is probably evidence that you may not be able to come back to restore muscle strength in IBM because in fact, first, there is skeletal muscle damages. There is important fat replacement. So it's very difficult to think that we will be able to restore muscle strength, since once we make the diagnosis, there is important muscle damages, definite muscle damages, and fatty replacements. So this is not because immunosuppressants do not improve the patient that the treatment are not efficacious. This is one point. And the other point is that the soldiers, the immune cells we saw within the muscle tissue, look like refractory to most of the immunosuppressant drug we use. And this is why Steve Greenberg developed these specific treatments that could be efficacious for treating this very specific type of soldiers. So probably that these immune cells, carrier G1 positive cells, are refractory to most of immunosuppressant drug we have, but maybe not to Apcuro. That could be possible. The point is that still, if we able to deplete or to delete all immune cell attacking muscle fibers in IBM patient will not be improved because there is muscle damages, and it will be not possible to come back.
So, really know it is coming up in May. Please visit our page with the webinar.